So today, last time in my talk, I had mentioned about replacing teeth and I'm sorry, I talked about tooth extraction and how, as a dentist, I do my best to discourage people from extracting their natural teeth as much as possible. However, there are situations where we absolutely need to extract a tooth. In a situation like that, what do we do next? Is it necessary to replace that tooth? Why and how is something I would like to cover today. When we lose a tooth, let's say, for example, in this case, this is a lower molar this person has lost. Most of the time, people think that, it's not a big deal. My chewing efficiency hasn't gone down, and they are absolutely right. Losing one tooth, maybe even two, is really not that big a deal as far as your chewing capacity is concerned. However, what it ends up doing is what I'm showing you here. It's called a domino effect, where, let's say, when this tooth is firstly immediately lost, these two teeth are standing upright. After a few months, these two teeth tend to start slanting towards the open space. When that happens, this upper tooth will then migrate downwards because it needs something to meet with. It cannot be in an empty space. And you can see now that the negative effect this is having on the entire teeth structure. These black areas you see are areas where food would start getting caught because now there are gaps and such. And that's where cavities would start rampantly. So what the danger of not replacing a tooth is not so much the chewing capacity, but more so the damage that you have on the entire dentition. If that ends up being more than one tooth, for example, here, there are two teeth on the top and two on the bottom, the damage is far worse, where now you have these two teeth coming down all the way to the gums. These are going all the way up to the gums. These front teeth start to flare out. And there is even much more damage on this entire dentition. So this is why no matter how many teeth are lost, except for wisdom teeth, unless the wisdom tooth was replacing one of your important molars, you don't need to replace a wisdom tooth. But other than that, every tooth that has been extracted, you should try and replace that as soon as possible after the extraction and after the healing has occurred. Now, let's talk of the different methods of replacing a missing tooth. Here are some of the removable kinds of dentures that we have. So there are two ways of replacing missing teeth. One is the removable kind of replacement, and another is the fixed kind of replacement, one that is fixed into the mouth. In the removable replacement, we have different varieties, but these two are the most popular. This is what it's called a metal valplast combination, which is the inside would have this cast metal framework. This metal is actually cast; it's wax, and then they cast it in the furnace, etc. It's custom made, of course. Whereas this is it's like a flexible acrylic. And so this one is a little more aesthetic. I prefer a combination if my patient prefers a denture over a fixed option, or for some reason we can't do a fixed option. My personal preference always is to give a combination of these two, which is doing the metal on the inside, but do these clasps on the outside so that, it's kind of blends well with the gums, and it's not, it's aesthetically a little more pleasing. The problem, so the pros of a partial denture obviously is that you have replaced your missing tooth, so all those negative effects I talked about in the earlier slide are obviously not there anymore. The cons of a partial denture as opposed to a fixed, of a removable denture versus a fixed, is that these clasps do have a negative effect on the teeth that are supporting them over the long run. It's just simple rules of physics, because if the tooth replacing this, if the tooth here is taking all the load of, as you chew, this pressure kind of moves this denture in this direction, and along with that, the tooth also tends to move ever so slightly. And over a period of 10 years, you are going to start to lose some attachment on those teeth. Compared to not doing anything at all, of course, this is a much better option. But it does have somewhat of a negative impact on the teeth it is supporting, which is why when we do design partial dentures, we try and take as much support as possible from multiple teeth, not just one or two teeth. Let's talk of fixed options. It's always preferable for someone to have a fixed option so that you don't have to bother with, putting it in and out, cleaning it all the time, worrying about whether it's going to fall out, if it's loose, etc., etc. So in your fixed option, we have two different kinds of replacements. One is what we call a dental bridge, and one is the dental implant. For example, in this case, this middle tooth is missing. In a dental bridge, we take the support. It's literally like a suspension bridge. Think of it like a suspension bridge, where you're suspending this fake tooth in the middle with support from either side. So we have to sort of do, every time we put something on a tooth, we need to kind of grind the existing tooth on both these teeth, and then the lab would fabricate something that looks and functions just like your teeth. This is then cemented in. You have to treat it like normal, where you brush around it and floss, etc. So the pros of a dental bridge are, of course, it's fixed in your mouth, so it's far easier to clean, etc. You don't have to worry about removing it. The cons are, because in this area it's connected, you can't floss very easily here. They have things like floss threaders, etc. But most people kind of tend to avoid that. It's a lot of work. So there is a chance that you might develop either bone loss or some sort of cavity in this area. But again, compared to not doing anything, or perhaps even the removable, this is a much, much better option. Let's move on to the next one, which is the dental implant. A dental implant is a standalone unit. It is a titanium screw that is placed inside the bone. And then there is this little part that sticks out, which simulates this part of the tooth. It's called the abutment. And then we put a cap or a crown on top of it. The titanium screw is placed either by an oral surgeon or an implant surgeon, or perhaps your general dentist if they are experienced enough. Once it is placed in, it takes about 3 to 4 months for the bone around it. You see the screw has these, it's like a screw, so it has these notches in it. And over about 3 to 4 months, the bone starts to form around these notches. It gets inside the notch so that it's held very tightly. We have to wait for that to happen and for this implant to be completely stable inside your bone before we go in and load it, as it's called, before we go in and sort of put the abutment and the cap so that you can start chewing on it. While that is happening, we either leave this alone, or we can put a temporary, if your dentist feels that yours is the sort of dentition where the teeth might move easily while we are waiting for these 3 to 4 months, they might suggest like a little removable temporary denture just to hold the space, just so that these don't start to move in. The advantages of a dental implant, obviously, are that you're not grinding tooth structure. It absolutely simulates a dental tooth. It's the closest to simulating a dental tooth in form and function. And it's very easily cleansable. You can easily floss between these teeth. The disadvantages usually are financial. However, nowadays there are more and more of these Chinese implants coming in, which are obviously cheaper than the regular ones. And some of them are quite good, some of them not so. So you have to kind of do your research and see which dental implant works best for you. Dental implants are not for everyone. If you're a severe diabetic and such, your body may not be able to generate that bone that's needed. If it's an uncontrolled diabetes, it may not be very wise for us to do surgeries and such. It might actually be counterproductive, in which case we would either opt for the bridge or the denture. The point is that, like I said, no matter what, it is extremely important to replace missing teeth. Now, let's talk about teeth where you have all your teeth missing, a full denture. Now, as you age, you're losing bone every year. You lose X% of bone every year, and you will notice that your dentures are getting looser and looser. Yes, you can go in and kind of, keep adding material to that denture to make it tighter, or keep making new dentures, but at some point, there will not be sufficient bone to hold that denture. The only thing that holds a denture in place is the existing bone structure. What has now come in the market is something called an implant supported denture. So what would happen is you would have, say, 4 implants. They're placed strategically in, like, say, one in a premolar area, one in this canine area, and then again on the other side. And then they fabricate a denture that sort of just kind of sits on it. It's like stuck into it. It's a fixed kind of an option. Where your dentist then goes in and screws it up from the top. This is one of the best options now in the market. Again, it is not for everyone, because you do need some amount of bone structure for us to be able to put an implant. If you have almost no bone, then the implant would be too short, in which case it defies the laws of physics, and we can't put an implant in it. So yes, so these are all the various options of replacing teeth, and the pros and cons of it. And I'd strongly urge anyone who thinks that they can function without teeth to go in for a consultation with your dentist and find out what your options are for replacing teeth.